and welcome to Ladies Who Launch. Thank you for tuning in today, and you're lucky you did, as today is going to be a whole episode on beauty, building self-esteem, and confidence boosting, and good self-talk.
Let us introduce to you Alina White, the Clinical Director for the Institute of Plastic Surgery for Board Certified Plastic and Reconstructive Surgeon, Dr. John Ayala. Alina is recognized as our hottest injector as a registered nurse in her field for over 20 years. In this episode, we will be asking her expertise on women whom Alina sees most in her office and tips on information on what we can do to feel and look our best from the inside out. But first, Elizabeth will discuss some issues pertaining to mental health and pressures on today's upkeep on beauty. Take it away, Elizabeth.
Thanks, Elizabeth. Okay, so let's break some things down from the start. In today's time, we're looking at all sorts of social media, and the bar it sets for beauty is high. Posts on social media many times present this idealized version of what's happening, or in this case, what's considered to be beautiful. This can lead us to constantly compare ourselves to others and think less of our own lives. If things are going particularly well for people in your newsfeed and you're having a rough day, of course this is likely going to negatively affect your mood, right? These persistent and constant negative moods can lead to intense feelings of worthlessness, depression, anxiety, and even worse is inadequacy. I'm not saying social media is bad and should not be used. However, I do strongly suggest that it should be balanced and should be used as a tool for enhancement. If we're not continuously keeping into consideration what unconsciously makes us unhappy, we can spiral down into self-esteem issues like depression, anxiety, and even more severe, the body dysmorphic disorder, which are intense perceptions or defects in appearance of your own self. So going to you, Alina, we wanted to know a little bit more about who you see and who patient X is.
Absolutely. Patient X can be described in many different ways. So one of our number one procedures in plastics is breast augmentation, and followed by, liposuction, mommy makeovers. But I've noticed that a lot of our patients who come to the office, the number one concern they have is after having a baby. There is something about a transformation with having a child, and your body goes through these hormonal changes, and the body changes. And you cannot actually compare a mommy makeover or a mom who had a child who's needing to have surgical procedures to be able to put things back to the way they were, right, that to somebody who has had a significant amount of weight loss. Wow. And so all those changes that take place are pretty abrupt, and not that it's hard on the body, but it takes the body sometimes to adapt to those changes. So from a hormonal standpoint, from a physical standpoint, you look at yourself and you're trying to get comfortable with the changes that you have experienced, from your breast going to this size to almost nothing, to your tummy expanding and your skin expanding, to being left with a little extra skin. And not to mention that when you do try to achieve your pre-pregnancy weight goal, your face also goes through that transformation. Because during that episode of pregnancy, you have that pregnancy glow, you have that real pretty radiance, all those abundant hormones that, have blessed our body with. And then all of a sudden we have our child or children, and you lose a lot of the nourishment, you lose a lot of that radiance. And mentally, our way of thinking, our psychological ability to process the change, it's not easy for everyone.
No, it's not.
Yes.
And then we see on social media all these posts on, beautiful models in their bikini after having a C-section,
yes,
2 weeks after. And, they're not really realistic goals. That's not something that really, Alina, 99% of women can snap back into. I mean,
and even those women who are in I mean, amazing shape. Unfortunately, as you age, you lose the elasticity to your skin.
That's right.
And you can look amazing in your 20s after you had a child, in your 30s. We've had women who have not had children. And because of the loss of elasticity, whether your hormonal levels are a little on the low side or weight loss, you end up with a little bit of that crepey skin, or you lose that perkiness from your breasts.
Yes.
Or you lose the radiance to your skin with or without children. So there's a lot of changes that take place. And when we have our patients come to the office, we look at the patient as a whole. And the mental processing of the patient's way of seeing themselves, the realistic expectations, us being able to achieve the goals that they're actually hoping they will have, it is our job to be able to help them understand that surgery is not the answer, although it will help to remove the extra skin or help fill the breasts the way they were. We try to help them, guide them, educate them, and assist them in helping them to understand that it is beyond of the external. You need to think outside the box.
Yes.
This is bothering you. Your issues with how you are seeing yourself and inability to be able to get comfortable with what you're experiencing at that time is beyond your tummy and your breasts.
Yes.
It's primarily hormonal. Even
Yes.
after having a child, we look at ourselves and we're even embarrassed for our
Yes.
husband
Yes.
to see us.
And we were talking about not long ago intimacy with the lights off, right?
Yes.
So after you have your baby, not everybody's very comfortable with their body. And, especially with their partners, and they may have been married a long time before then, or maybe just married and had a baby. But, the intimacy factors change, and feelings of shame, which is just, and guilt, even are just some of the most detrimental emotions, because even anger has its purpose.
Yes.
Sadness has its purpose. But these feelings of shame and guilt, these are the emotions that really don't serve a purpose in the long run.
Yes.
So when these women come to your office, Alina, do they tell you their emotional sides of everything?
So, it's interesting that you asked that question, because as a nurse, when I have the opportunity to question the patient's background from a medical standpoint and asking them what's one of the reasons or many reasons that they're coming to see Dr. John Ayala, they open up. There's a certain connection with the nurse, with the patient, and they start expressing some of their concerns, and they know that the role of the physician is, to give them their expertise in regards to surgical aspect on improving, their appearance. We make sure that we also look at their being from a very deep perspective. Health, medical, okay? So hormones. Number one, have you been checked? Have you gotten back to normal? Is your mental, the way you're seeing yourself, could that be provoking a little bit of depression? And depression
Yes.
is huge,
Yes. Yes.
whether it's a change of job, weight gain, divorce. Are you okay? What can we do? Or what is it that's bothering you? Why are you why do you feel like you look a certain way? A lot of these patients open up and start expressing, and our job is to make sure that we guide them to the right direction.
Yes.
That to whether it's a little bit of a workout, because we don't gain a patient by just taking their money. We gain a patient by earning their trust.
Yes.
And giving them the guidance and the direction and the right recommendation before we get them ready for that big step to have surgery. And because after surgery, that too takes some time to recover, adapt, accept, be comfortable with. And so it is interesting to see how our view of our external being is affected by our way of thinking.
Yes.
I mean,
Our
it is
mental aspect, absolutely
incredible.
And what Elizabeth and I always talk about is, how emotions, for the most part, emotions are not straight across, right? Sometimes they have their ups, they have their downs. And, after pregnancy, on a personal note, Elizabeth, you knew this, that after I had my baby, I had a little bit of the baby blues, and I didn't want to leave my house for a whole year. It was a whole.
What is wrong with you, woman? Stop.
Because it's postpartum depression, and postpartum depression sometimes it affects women. 1 out of every 3 women, I think, are the stats. And it's not. It doesn't have to be so severe as like a postpartum psychosis, but feelings of anxiety or of depression or not wanting to do something. These are all normal emotions that happen between 1 in 3 women. And it affects, hormones and depression and our own perceptions of us, of ourselves, make a big difference.
Yeah, and it's interesting that you're mentioning the fact that you're one of the few that recognizes it because of your background. There are many women that don't, and because of that severe fluctuation, there are some marriages that suffer from it because there's spouses that don't recognize why their wife is just not the person that they married, and why is she wanting to go and fix herself? Is she thinking of somebody else?
Yes.
And then you go and it's just incredible, and you're trying to process, and then you go and you talk to your professional, your OB-GYN, and with all due respect,
you get 5 minutes and they're out.
And there's very few, but many that will take care of you. But a lot of us don't have the comfort level to say, I feel like something is wrong. I don't want anybody to label us as being crazy. Let's just that's the number one thing that people are going to think. Is something wrong with me? Why am I feeling this way? Why am I not wanting to be with my spouse? Why am I, having these feelings of, am I not doing enough for my child? And so, that is huge. And that, again, is a hormonal shift. So in our time, I feel like it's important, particularly, in our field and the people that we come across and cross paths with, it's important to be able to express, communicate, and be an advocate and being able to hey, listen, you're not the only one.
Absolutely.
There's many of us. 2 out of 3 women suffered the postpartum, whether it was light or severe. And I had no clue I was experiencing some of that. I was right there with you.
Yeah, especially if she hadn't been like, Elizabeth, let's get up. I'm going to go see you. I'm going to knock on the door anyway. It would have taken me a lot longer. And I think, with situations concerning the birth, sometimes births can be a little bit more traumatic than others. I think that is also, can spiral us into somewhere our firstborns, you don't know how to hold a baby. You don't know how to feed a baby. There's no guidebook on parenting, right? You're always questioning yourself. You're always wondering, am I doing the right thing?
Right thing.
Am I letting people down? Is my husband upset at me because I'm not spending enough time with him? Am I being a good enough mom?
So, Alina, what kind of advice do you give? Because I've heard this a lot with women after having kids. They almost, they're a little bit ashamed of their bodies. Because it takes time. It takes time to get that body. Your body is never going to look the same like it did when you were in your 20s. Hands down, it's not. Whether you're the most healthiest, the most active, you're a fitness trainer, it does not matter. After having kids, your body just changes, period. That's it. That's reality. So what do you tell your patients that come in and they feel ashamed, almost like they become closed off a little bit, even with their partner?
Sure.
What is the one thing, what do you tell them when they come in? It's like, in the intimacy part.
Yes. So one of the most important things that we do as medical practitioners is we want to make sure to assess that there isn't an underlying issue. Sometimes even after having children and you having a severe fluctuation of hormones, we want to make sure that you do have, number 1, clearance from your OB-GYN, okay? And number 2, if there is any underlying issue in regards to mental instability or depression, you never want to operate or you never want to go through any surgical procedure until you find out if you are, hormonally balanced, if from a mental and psychological standpoint, make sure that you seek help. And sometimes we don't want to go and tell our husbands, a lot of this, it's just kind of embarrassing,
Yes.
Because you don't want to be labeled as something being the matter with you.
Something's wrong.
Yes, it's, having the right support system is very important. And before you move forward when we feel that you are a candidate to move forward with plastic surgery, make sure you do your homework on the person you seek. Okay,
Good.
read
Yeah.
their reviews.
Yes.
Because in many cases you'll have surgeons that can perform the procedure, but they don't have the right support system to help you get through the post-operative care.
Yes.
So that's huge, and being able to have multiple people handhold you through your transformation, because it's at least a 1-year process until you see the end result, depending on the type of procedure you decide to have.
Yes.
So,
Wow. Well, Alina, thank you so much for all of your expertise and just everyone in the San Antonio area. Alina is just the best at what she does, and she really makes a difference. And it makes a difference to go to somebody who you can talk to and say, you know what, Alina?
She cares.
Yes.
She cares.
We care.
She's scared. Yeah.
And I feel this way, or, to have the trust in your provider to tell them really, hey, what's going on? This is what's happening. I'm feeling this way, and to be upfront and to be honest, because no one can help you out unless you tell them what goes on.
Yes.
So I wanted to thank you.
thank you, Elizabeth. And I'm honored. I thank you, Elizabeth and Lizzie, for having me. And purpose is to be able to spread the word and know that you're not alone.
Yes.
And so even if you have questions, love to help out in any way we can.
Yes. Yes.
There you go, ladies. Take away the information that was given to you and use it as a tool to better enhance your overall emotional well-being. Keep in mind that beauty will forever come from the inside, because outward beauty is just for a short time. What's left of you after taking off that beauty mask is what matters most. Finding your purpose, your love for yourself and others, and the kind things you do for yourself and others is what will lead you to a much happier and more fulfilled life. Keep a conscious eye on the amount of social media as well as the self-talk you're telling yourself. Really question, is this positive self-talk or negative self-talk? I highly recommend using a simple exercise of writing down 3 good things about yourself daily, whether it be about your hair, your day, whatever. Just 3 positive things every morning or every night for a few solid weeks. Use a writing tablet, your phone, whatever is next to you in that moment to write down these positive attributes. You'll begin to notice a huge difference in self-talk habits. Look at them often and remind yourself of all the great things that encompass you and your life. Thank you for tuning in, and we're looking forward to having you join us for our next episode. So ladies, plug in, and together, let's lodge.